Hello everybody, I am Dr. Ganesh Mathan, Senior Cardiologist from Omega Hospital, Gachibowli, Hyderabad. Nowadays there is a lot of awareness among the public and a fear among the public regarding the cardiac deaths and sudden cardiac deaths which we have been noticing past couple of months. Some big celebrities have lost their life, some health freaks have lost their life, young people on road, gymming people, many people have lost. So today we are discussing about what is the value of CT coronary angiogram. There is a buzz about this test and lot of people inadvertently and just they go to the labs and to the diagnostic center and ask for themselves without any doctor's prescription. Yes, CT coronary angiogram is a very valuable test to define the anatomy of the coronary arteries and to notice if there is any blocks. If the CT coronary angiogram has shown that the person's coronary vessels are absolutely normal, it is 100% normal for that person. We don't have to worry. But let us say if the CT coronary angiogram shows that the person has mild moderate blocks amounting from 30 to 70% in one vessel or in multiple vessels, then we need to re-evaluate and confirm these findings with a coronary angiogram. What does the CT coronary angiogram do? CT scan, we all know, CT scan brain, every person in the family, one person probably would have underwent a CT brain or CT abdomen something. So CT scan is like an high-end photography machine. It takes the photo. When I tell you, okay, I am going to take a photo of you, I expect you to stand still. If somebody is moving, we say, please don't move, I am taking a photo, please don't move. That is good. So you need to be still. So every part of the body is still. Shoulder joint, it's still. Brain, it is still. Lungs, if you just stop breathing, it's still. Abdomen is still. Legs is still. Knee joint is still. Hand and finger and toes, everything, eyes and nose, everything are still organs. So perfect photo you get. And CT scan as a modality for testing in these organs is 100% perfect. But then how does heart differ from rest of the organs? Heart is the only moving organ in the body. You sleep, the heart is pumping. You run, it pumps faster. You climb stairs, it runs more faster. You are anxious, it still pumps faster. So it's constantly in the moving thing. So the CT scan has to take the picture when the heart is in that fraction of second when it is stationary. So the heart is pumping, it is relaxing. At this point, you take that ultra-second photography and then you have to just recalibrate in the CT machine to find out if there are any blocks. So, are there any chances of wrong information from the CT? Definitely yes. As I said, if a person says 20, 30, 40% block in the CT coronary angiogram and subsequently we do a coronary angiogram, conventional angiogram, what you are seeing now here, this angiogram, we see there is a huge difference. The 30% block what has been reported in CT coronary sometimes can be 80%, or 60 to 80% block which has been reported in the CT coronary can be 20% also. So friends, if you are absolutely normal, if you don't have any vices, you don't have any family risk factor, you don't have chest pain, you are absolutely fine. But just because of the current scenarios where we are seeing a lot of people in the neighborhoods, in our office or distant relatives collapsing for the cardiac, you want to get your test done for your heart. CT coronary is the thing because we expect your heart to be normal. And when the CT scan shows your heart is normal, your heart is 100% normal. There is no question about it. But if you have some symptoms, when you climb upstairs 2 floors, you start panting, you have occasional chest pain, you have some kind of an atypical chest discomfort which is bothering you, you are a long-term diabetic, you are hypertensive, you have a family history of strong cardiac diseases, then you must consult a doctor, because sometimes as per the doctor's suggestion, he may ask you not to go for an CT because he suspects there is a fair possibility that you may be having some coronary disease, and then that's how we can avoid 2 tests. So he may suggest you an angiogram, which is the 100% gold standard test for coronary anatomy evaluation. CT angio, I can rate it 95%. Normal conventional angio, 100%. The subset of people who should need coronary angio, the doctor decides, and as per our thing, we see this. And please consult a doctor before randomly going to a diagnostic or a hospital and asking for a test, just like get my sugar test done, like that. Thank you very much.